How you doing, Mr. Gordon?
Dr. Quinn, how's
So
it going?
good you came. Miss Gordon, you got him to come. How about
yes,
that?
I did, but it was hard to get him to come. I had to just drag him out today.
But I keep telling her, I feel fine, so I really don't need to see anybody right now.
Well, I'll tell you what, Mr. Gordon and Miss Gordon. Can I share a story with you about a really good friend of mine?
Sure.
Okay. Mr. Gordon, it's really important for you to get your physical. And, you know, like your wife said, you haven't been here in a long time and, you know, you say you feel good all the time, right?
Right.
Right. But look, I just want to tell y'all about a patient that was a dear friend to me. Still is a dear friend to me. He came by to visit just to check me out. And I convinced him and his wife to go ahead and get a physical. And they told me that he hadn't had a physical in over 10 years. He said he felt fine, just like you did. So we did the blood pressure, everything was good, no diabetes, all the blood work looked good. But then we got to the part about the male exam. You know, it's recommended that all men over the age of 40 get a prostate exam. Well, he didn't want it. That's fine. It's recommended to have that exam, but I reasoned with him. I said we could just do the blood, and if it comes back elevated, we'll go from there. And he agreed to it. It turns out his PSA, which is the prostate specific antigen, was 8.5, and it's supposed to be less than 4. I referred him to a urologist. He had a simple procedure. He did have cancer, but it was diagnosed early. They did the procedure and told him to come back in a year. His life was saved. Now, had he have not gotten that physical, that cancer probably would have grown and grown and grown. And by the time he developed symptoms, such as blood in the urine or painful urination or other problems that go along with advanced prostate cancer, it probably would have been too late. So getting this physical today can possibly save your life as it did my friend. I'm glad you came, man.
Well, hearing the story you're saying now, I'm glad I came too.
Right. All right, well, let's go ahead and do it.
Okay.
Hey man, we better than Tom Joyner. Moving on up. I'm trying to tell you,
You're right.
you know what I'm saying? Tom Joyner, how you be doing? Getting people to the doctor today? Getting people to come out to the doctor?
You're right. You're right. Because most men don't want to take that finger test. And so,
Let
Dr.
me
Quinn.
just say that the bottom line is it's recommended that you do the digital rectal exam and the blood test. But for those out in the viewing audience, if you want to have a discussion with your physician about possibly doing the blood and getting the results back, like the gentleman we talked about, that's an option. Now it's recommended to do both, but the blood is better than nothing at all, and that's what happens for a lot of men. They don't go to the doctor because they don't want that test.
But Dr. Quinn, we appreciate you for doing this because helping get the awareness to where guys will come out and go to the doctor.
Yeah, because we need to encourage men to go to the doctor a
Hey,
little bit more.
it can save a life.